Your CNOS Health Watch on Siouxland News.
As fall turns to winter and things become slick, it's easy to fall down and get hurt. That's why it's important to know if your injury is more than just a sore shoulder.
Siouxland News reporter Katie Ling talked with orthopedic surgeon Dr. Ray Sherman to learn more.
Dr. Ray Sherman is one of 4 fellowship-trained orthopedic surgeons at CNOS. Dr. Sherman and his colleagues see hundreds of injured rotator cuffs every year.
So when we look at a shoulder, we have the large muscle, like my hand, called the deltoid, and that's what you see up on here. We take that off, and then we have 3 muscles that are shaped like the hood of your parka. We have one in the front, one in the top, and one at the back.
These 3 muscles make up what is known as the rotator cuff. Problems happen when the bone underneath irritates or tears the muscle.
So the primary symptom of rotator cuff problems is pain. We see anywhere between inflammation of the rotator cuff all the way through a partial tear to a complete tear, and the complete tear can be small or large.
Most of the time you'll know you're injured, whether it's from a fall or a sports injury, but as we get older, smaller events can cause problems too.
The rotator cuff loses its thickness as we get older, and just like the knee of your favorite denim jeans, it'll start to wear and get thinner and thinner, just like your rotator cuff will do the same thing. And of all the people with rotator cuff tears that are over the age of 60% of them have silent tears. They don't know they have them.
If you start feeling shoulder pain at night or your shoulder gets weaker, it's important to get to a doctor. Because if an injury starts scarring over by itself, surgery gets more complicated and recovery can take longer. And watch out as seasons change.
In the wintertime, slip and fall on the ice, an extremely common time for people to get a tear or an injury to their rotator cuff.
And if you do get hurt, Dr. Sherman says surgery isn't always the first step.
The first line of treatment for them would be to go to physical therapy with medication, and will be prescribed physical therapy. Now, if they need physical therapy, we have physical therapy in all of the CNOS offices, so it's close by. We can communicate with the physical therapist along their therapy course.
For Siouxland News, I'm Katie Ling.